Warriors. This is Dr. Jof. And a little something about my family, no? My father actually grew up in Luway, Bohol. And today, natay mga pangutana gikan sa taga Bohol sa Ask Dr. Jof nato is a segment kung wala mo kabalo where I answer questions about hip and knee arthritis, osteoarthritis, rheumatoid arthritis, TB arthritis, about treatment, diagnosis, and even share simple tips. So today, sa atong segment na Ask Dr. Jof, we have a question from Bohol, and this is from Ma'am Gliceria Genita from Bohol. So si Ma'am Gliceria Genita. Hi, Doc. Good morning, Ma'am Gliceria. If you're listening, I'm just reading your message. No, I and my cousin have the same problem on our knees. We're both seniors. Me, 71, and my cousin is 68. We're planning to come to Cebu one of these days to see you, for we're always following you. Wow, always good. So I hope you listen to this. We're still trying to save some amount for this purpose. Can you give us an idea of how much we're going to spend for the consultation and possible laboratory expenses needed, or maybe treatment if possible? For we know that it will cost a great amount, for example, knee replacement or the injection. Hope to hear from you, Doc. Thank you. We are here in Bohol. So, salamat sa mga pangutana ni Ma'am Gliceria. So, she's asking, no, kay that valid man sa dang mga pangutana nato. If you are coming from the provinces, I do see patients from Bohol, Leyte, Negros, even in Mindanao, and as far as Mindoro and Masbate. And ganahan sila na they know what they want to spend. But really, Ma'am Gliceria, for a consultation with me, you get a 20% discount because senior naman mo. And that's around 600 pesos, 620. And if you are thinking about laboratories, the most basic test that I usually charge for or request is an x-ray of the knee. The x-ray is usually less than 1,000. So, possibly for your trip to Bohol, just bring around mga 3,000 pesos. Back and forth trip. Some patients come to Cebu in the morning, go to Bohol in the evening. So, daghan mga pasyente na muanhi lang para magpakonsulta gikan sa probinsya. Now, with regards to the management, we do have different managements for the different types of arthritis. So, lain-lain klaseng arthritis, lain-lain sa dang atong buhaton. And if you have an injury or arthritis, treatment is lahi-lahi sad. So, before I talk about mga treatments for arthritis, I really would like to examine the patient. But since you asked specific kaayo about kanang mga injections and replacements, I have to inform you that kanang injections like the injection that is a cortisone or steroid, if you have PhilHealth and your ID number is valid, you get a very big discount because usually the injections can range around mga 10,000, but you can get a big discount with PhilHealth. Bring your PhilHealth ID, the injection will only be 3,000. That is the cost of a cortisone injection. The hyaluronic acid injection is a little bit more expensive. The range here in the Philippines is around anywhere from 17 to 40,000. But here in the clinic, we usually have a hyaluronic injection that is 17,000 for seniors po. Tapos, it can really vary on several factors like it's not just me, no, the clinic or hospital where the procedure or injection is done or performed, the type of hyaluronic acid that is used, and the number of injections na require sa doctor. So, personally, me, I like the one injection, meaning bigger volume. But remember, it's important to note We don't do hyaluronic injections for meniscal tears and knees that are already very swollen because they worsen mo grabe ang kanang sakit sa tuhod, mo grabe ang hubag. Kung hubag na daan, sudlan pag idugdaghan volume of hyaluronic acid. So those are the two main injections that I use, the cortisone or steroid and the hyaluronic acid. And if kinahanglan gyud og kanang knee replacement surgery, the cost here in the Philippines can range for about 200,000 to 500,000. These are just estimates. However, it's really important to note that, again, it depends on the hospital, the surgeon, and if you have any medical problems that need to be treated first. I don't personally advise knee replacement right away, especially if first time nato magkita, no? I want to know what you have done for your knees first, unsay na suwayan ninyo, what you have tried, because we wanna try the other maintenance medicines first, maybe therapy, if you have not tried these. Remember always to ask your health provider there in Bohol because who knows, maybe they have an idea of how much it would cost. But here in Cebu, I also do charity surgery. So the charity surgery, for those na interesado, walay bayad ang doktor, walay bayad ang anesthesia. The hospital is highly subsidized, of course. You have government institutions like the PCSO, DSWD, and PSWDO that can actually help you with the cost for these bigger procedures. So, what na ibayad ang doktor, tabangan sad ta mo mukuha og sponsors, and tabangan sad ta mo mukuha or mo apply sa kanang mga government institutions para dako mo ma-save. I've had patients who have saved over 200,000 pesos and spent only mga 20,000 for their knee replacement surgery diri sa Cebu. And I hope na nakatabang ko, I hope na nakatubag ko sa inyong pangutana. I hope to see you in Cebu. Ay lang sa huna-huna kaning mga kwarta na mga expenses because really, pangitaan man natong paagi. Tabangan man ta mo nako. And in the end, what is best for you is kung unsay inyong ganahan. Di sad ko magbuot kay inyuha man ng lawas. So I hope this helps. Ma'am Gliceria from Bohol. I'm going to end this now and hope to see you soon. I'm here in 401 Robinsons Cybergate, Monday to Friday, except Wednesday, 10 to 3. Please, best set an appointment. Bye-bye.